Hello, I'm Dr. Sugar, your internet doctor, here to continue our discussion on the common cold. I will go into a lot more detail on what the traditional and the alternative treatments for these viral illnesses are. So if you're ready, let's get started with a dose of medical inspiration. So you have a runny nose and a lot of sneezing and a scratchy throat and congestion. Well, now what? Should you go to the doctor or try to doctor yourself? If you have a cold, symptoms may worsen for the first few days. Sometimes that clear runny nose may get thicker and even turn yellow or green. That's okay. That's normal for a cold. That old idea that if you have green stuff coming out of your nose that you must get an antibiotic has been shown to be false. So you usually do not need an antibiotic even if this starts to happen. The entire cold is usually all over by itself within a week or so. If you're still having symptoms after a week, consider seeing your doctor to make sure you don't have something else going on like a sinus infection or allergies. And like I said before, if anything out of the ordinary or worrisome happens, like shortness of breath, abdominal pain, vomiting, coughing up blood, or white patches on your throat, get in to see your doctor right away. There's no reason to wait. If all you have is the common cold, you can probably do just fine on your own at home. Here are a few tips to get you through. Make sure you're getting extra rest and drinking plenty of fluids. Now, I don't mean pop or soda when I say plenty of fluids either. I mean water and plenty of good juices. And I think vitamin C and zinc are beneficial. Now, some of the studies don't always show this to be true, but I always personally megadose on vitamin C because it helps me. So take that with a grain of salt. If it helps you, you take it. Echinacea, the latest studies have shown that echinacea is helpful as well. So if you feel like you're coming down with something, echinacea, vitamin C, zinc, lots and lots of fluids, and extra rest are a good idea. And even though this is just a cold and the doctors aren't going to be able to do much to fix it, that doesn't mean that you don't feel crummy. So it's okay for you to consider some over-the-counter treatments to decrease your symptoms. They won't make the cold go away any quicker, but you will probably feel a lot better and function better while you have it. And again, antibiotics should not be used to treat a common cold. They will not help, and they may make the situation worse. Now, the FDA recommends only 3 categories of over-the-counter medications that are okay to use when you have a cold or the flu. The 3 categories are expectorants, cough suppressants, and decongestants. Expectorants are the cough syrups that help loosen mucus and help eliminate the phlegm. The second is cough suppressants, and cough suppressants are called antitussives as well. These are great when you can't seem to control coughing episodes, and especially if you're planning on being around a lot of other people. This category includes throat lozenges, drops to add to your vaporizer, and also ointments that are rubbed onto your chest. Now, the third category is nasal decongestants, and these open up blocked nasal passageways. You can spray them into the nose or take drops orally. Medical experts now agree that using cough medicines and cold drugs should never be used in children under age 6. If your child is ill, talk to your doctor before giving them any of the over-the-counter medications in this category because, number 1, they don't really work very well for kids under age 6. Number 2, they have serious side effects as well. If your child is over age 1, one thing that I would consider is honey. Honey works very good for cough, but remember, you never give this to a child under age 1 because of the risk of botulism. And of course, chicken soup has been used for treating the common cold at least since the 12th century. It may really help. The heat, fluid, and salt may help you fight the infection. My dear grandma made chicken soup whenever we were sick growing up. But her chicken soup wasn't that ordinary chicken soup out of the can. She packed all kinds of things into the soup that we now know have antiviral activity. Things like onions and garlic and sweet potatoes and big chunks of chicken. And don't forget the noodles. She put those thick noodles into the soup, and it was always fun to eat, even when we were sick. That chicken soup got me through dozens of colds and flu throughout dozens of years. Maybe it'll also work for you. But in the meantime, use the other recommendations that we've talked about today. I'm Dr. Sugar. Cheers to chicken soup for your next cold or flu. Thanks for watching, and if you haven't already done so, make sure to catch all the videos in our series on the common cold as well as influenza. And when you have a medical question, Be sure to check the video content library for many more medical topics. I'll join you soon for your next dose of medical inspiration.
Children.